Hello, Dr. Morse. I really like your videos and would what you do to help people. Thanks. You come join me. Come join me. I am from Albania and have a question about my father. He is 66 years old and his heart problems through the years. Calcification of one valve and heart failure. Is that arrhythmia? Is that what that's supposed to be? And lung and leg edemas. Okay. So when you see edema, first of all, let's go from that backwards. When you see edema, you see swelling. Know that water is the universal solvent. Notice how you get in the water? It's a universal solvent. So when you have water being pulled into areas, what is the body attempting to try to do? And what areas would the body pull water into? And that would be your highly acidic areas where you have stagnation of lymph. You're going to have edema. And you're going to also see edema throughout the body because of the acidosis and kidney failure. Whenever you see someone's ankle swollen, the first thing we always did, even in the medical world, was kidney failure. Or we see redness all around the ankles and all that, kidney failure. I always used to say that. I don't know why they've gotten away from that. But when you see someone's edemic ankles or swollen ankles, you know immediately the kidneys. You go right to the kidneys. And that's everywhere. It can be congestive heart failure or anything else. If he has congestive heart failure, that means there is some genetics probably, and the lymph system in the heart's been backed up since day one. But wherever you see the lymph system backing up, this is where you have congestive issues, acidic issues. Now, let's go to the heart valve. Why would a valve get calcified? Why would any tissue in the body, the vascular walls, get calcified? You only see calcifications in the presence of acidosis, where you see the leaching of calcium out of the matrix, whether it's connective tissue or bone or whatever, and then the heart, when it hits acids, of course, that's what they do. You know, that's why you have bone matrix, phosphorus and what? Calcium. So it just shows you here that your dad is very acidic and been that way, and that he's having kidney problems and kidney filtration problems, and it's backed up all through him. So to fix this problem, you have to first get the kidneys to start filtering. You have to first fix the edemic issue, and the edemic issue is an acidic issue. And the acidic issue would then fall into where? The lymphatic system, and the kidneys control the lymphatic elimination. See, so it all fits right in there perfectly. Calcification of one valve and heart failure. Okay, maybe he has stress too because of the loss of his son from stomach cancer 3 months ago. His son from stomach cancer? No one should ever die from stomach cancer. Wow. Well, I'm sure he's... Well, what would that do to your dad? It would shut his adrenals down. And if you already have kidney problems and you shut your adrenals down even more, you see what I'm saying? Everything gets shut down, shut down, shut down. This world likes to shut you down. And we're not going to let it. Not going to let it. So, doctor gave him antibiotics for what? For what? See, and that's the problem. This is the idiocy of allopathy. We'll just give your dad some antibiotics. For what? And in doing that, you're killing the lymph node bacterium, which then sets up for even greater edema. Oh yeah. Oh yeah. I mean, you have to understand how the body works here. Where's the bacteria besides the gut? And you're going to go right into the lymph nodes. And why are they there? What's their job in lymph nodes? And again, they deal with acids and breaking down acids, so we don't have such acidic urine. Gave him diuretics, which I would, if I was a doc too, I would have given him a diuretic to get that, but that's kidneys. And blood thinner, and said maybe he needs surgery of the heart. Can you help us with some advice? Can he be cured without surgery, and what to use from your herbs, and for how long, especially what lymphatic and adrenal granular, and for how long? Well, here's the thing. You know, if I gave the, that's why I have a video up for kind of what you would do in different cases, because it's hard for me to give you the total makeup of a protocol for each case here. But it is so cheap to have a counselor here. Just set your feet on the path. It doesn't cost a couple $100. I mean, it's well worth it. If not, I would just get on the get on the 14-week protocol and just add the heart formula somewhere down the line. But the real problem is the lymphatic system. That's giving you the edema, that's giving you the calcifications, that's giving you all these things like that, the lung and leg edema. I mean, your dad's in trouble, there's no question. So he needs to get moving on this. Get him on a fruit diet, fruits, berries, and melons. Since he's not, you could probably give him a salad a day maybe. One doesn't need surgery unless you're at the very end of something or you got an obstruction that's blocking a major flow of something, blood or whatever, nerve. I don't know what all he's dealing with. You can dissolve the calcifications, but in dissolving calcifications, what medium would we be in? An acidic medium or an alkaline medium? An acidic medium creates a cationic environment. Now, a cationic environment would seem like it's an environment of corrosiveness, and then it would rip things apart, because that's what cationics does. But in that process, it dehydrates, burns up electrolytes, and creates agglomulation, stagnation, hardness, stiffness, tightness. So the first order of the day is to get your dad in an alkaline slurry and get an alkaline forming foods and an energetic forming foods that'll open up the vascular system, foods that'll clean the arteries out. Not that they need cleaned, because occlusions come with the thin wall. That's the lymphatic system. So it's a lymphatic system and congestive heart failure and valvular problems and everything else that you need to go after. I submit to you also, I'd be looking at the parathyroid and maybe looking at the bones formula to strengthen maybe the valves. But to strengthen anything in the body, you have to remove the acids that are creating the problem. You have to fix the problem. You can't treat the symptoms. You got to always fix the problem. So, or the cause of the problem. We can't find here organic fruits and vegetables, so he can't do a proper detox. Well, get a veggie wash and wash them. But they're sure a lot better than dead foods. So you get what you can, you do your best with what you can, non-organic okay, but wash the pesticides and everything off as much you can, because it's better than nothing. It's better than saying, I'm not going to do it because I can't get the food. No! What can he eat? He can eat whatever you can find, in whatever shape you can find it in. I mean, I hate to say that, but there's nothing else we can do, guys. I have some menstrual disorders, loss of my periods about 6 months, now, and high prolactin levels. Check your pituitary, honey. I do the same thing. Get my kidneys filtering, get my cleaned up. Look at that pituitary, because if you're not menstruating, I'd be looking at the pituitary, not the ovaries. Could be ovarian, but I doubt it. You got two, so I would be looking at the pituitary. To be quite honest with you, and upper circumbraining nerve. Get your lymph moving, get your bowels cleaned up so your sinuses can drain. Start working on all this, and all of that will correct itself. Always does. Also hot, exactly. Yep, because it's probably bumping down on the thyroid and parathyroid, and that being your dad might see some parathyroid issues there as well. So you want to take a look at that. Get everybody's eyes, take a look at the eyes, see what you see. She's 33 and not pregnant. Please help. Thank you very much, and sorry for the bad English. That's okay. I got bad English myself.